Hi, my name is Doran Raffi. I'm a dental hygienist and a graduate student at Pepperdine University, School of Education and Psychology. I will be presenting my final research paper, which I have conducted within my own profession. I was lucky to be able to choose a topic that is a subject I've always wanted to do research on. This research presentation is entitled 4355, A Code to Remember, and is about a controversy over a dental procedure called gross debridement. If you're not involved in dentistry, you might be asking what code 4355 or gross debridement means. Therefore, before I go any further with my presentation, I would like to briefly describe what each of these words means. ADA has set a series of codes for most of the procedure performed at a dental office to achieve uniformity, consistency, and specifically to accurately report dental treatments to insurance companies. The code 4355 is entitled by ADA as full mouth debridement. It is the gross removal of plaque and calculus, which is the same as tartar or hardened dental plaque, that interfere with the ability of the dentist to perform a comprehensive oral evaluation. This means if a patient comes into an office and there is so much buildup on the teeth that the dentist cannot perform the comprehensive exam on the patient, the dentist or the hygienist does a gross cleaning and remove the bulky calculus to be able to see those areas that were under the bulky calculus. This procedure is not a complete cleaning. The patient has to come back to complete the cleaning with a definitive procedure. What is gross debridement? Gross debridement is removal of bulky calculus for the dentist to be able to do a comprehensive exam. The patient then comes back at a later visit to finish the cleaning. You're probably asking if these two procedures are the same. That is one of the questions of this research. But for now, I will be calling and referring both procedures as gross debridement, since in both procedures we grossly remove the calculus. Why did I choose this topic? I graduated in 2009. In my program, gross debridement was strongly prohibited to be performed because of its adverse effects. When I began working in dental offices, however, gross debridement was a routine procedure, and I was expected to do the same. When I would discuss what I've learned in school with the dentist, she would say, "I understand, but look into the CDT book. There is a code for this procedure. Therefore, this procedure is okay to be implemented." Since then, I've always wanted to gather more information about this procedure and find out if other programs do teach their students about gross debridement, the same as I learned, and if other offices use gross debridement too. Who would benefit from this topic and from this presentation? You, as a patient, will benefit from this research presentation because you will learn about gum diseases and the procedure that fits you. You will also learn to ask and think about the procedure that is going to be implemented on you. Dental professionals will also benefit from this presentation because they would understand why gross debridement should or should not be implemented. Here are my research questions. What were the dental hygienists taught in school about gross debridement procedure? Are dental professionals aware of the potential adverse effect of gross debridement? Can this procedure be replaced with an alternative definitive periodontal treatment? Is full mouth debridement the same as gross debridement? I would like to spend a couple of minutes to show you what a healthy mouth should look like and what gingivitis and periodontitis means. This is a picture of a healthy mouth or a healthy gum. When you look at it, it's all pink and it's firm and it's attached to the tooth. When you floss or when a hygienist or a dentist poked your tooth with any instrument, it would not bleed. When you look at the x-ray, the bone, which is right here, is exactly where it starts, exactly between the crown of the tooth and where the root starts. So it's right here. For a healthy mouth, we recommend a normal cleaning, which is called prophylaxis, and the code for it is D1110. If someone does not have a healthy gum, they would either have gingivitis or more severe than that would be periodontitis. Gingivitis is when the gum around the tooth is red and inflamed, and if you floss or we poke the gums with the instrument, it does bleed. But when you look at X-ray, the bone is still the same. There is no bone loss. So gingivitis, therefore, it is reversible. That means it can go back to healthy. Why? It is because when we clean the teeth, since there is no bone loss, the gum around the tooth becomes healthy and it goes back to healthy and it reattaches. Now, what is periodontitis? These pictures represent periodontitis. Patients with periodontitis don't necessarily have this much calculus on their teeth. For example, here, this patient does not have as much calculus outside and above the gum line, but they do have inside the gum underneath here. When you look at their x-rays over here, there is a lot of bone loss. So the bone is not where the crown is and where the root starts. There has been bone loss because of the bacteria underneath the gum. Or when you probe, you also get more than 3 millimeter, like 5, 6 and up, which means there is bone loss. We recommend deep cleaning for these type of gum disease to go underneath the gum and be able to clean any calculus or builds up underneath the gum and remove all the builds up. Periodontitis is not reversible because the bone will not grow back, but fortunately the tissue can heal and attach to the tooth once it becomes healthy. With this picture, you can imagine what the purpose of code 4355 is. If a patient comes in with this much bulky calculus that the dentist cannot do a full mouth exam, a dentist or a hygienist will remove this bulky buildup to see if there is any cavities underneath them. Keep in mind that code 4355 guideline says that the gross debridement and full mouth exam should not be on the same day. The patient should come back typically after 14 days for the full exam and the recommended complete cleaning. What I have learned in school and what literature says on gross debridement. Gross debridement is an incomplete removal of calculus which is no longer recommended. This technique may be problematic and may result in several consequences. When we remove the bulky calculus from above the gum line, the tissue becomes healthy and, as I said before, it will reattach to the tooth. You can see here, this is what the healthy gum is. It is attached to the tooth. But here, where there is a lot of buildup on calculus, the gum is inflamed and is not attached. When you clean and remove these calculus off, this portion of the gum becomes healthy and it reattaches to the tooth. But this portion of the gum, where it's not reattached and it's not attached, and there is a lot of bacteria and calculus underneath it, starts beginning like it make up a bag with a tightened knot on top, and it becomes an abscess, just like that. Also, when this portion of the gum attaches to the tooth, it will be really hard to insert the instrument next time to clean and go underneath and clean all these calculus off. Another thing is, when the patient comes in like this, with a lot of bulky calculus, and we do the gross debridement, above the gum line, there might be not much calculus left. That's why the patient goes home and says, "Ooh, my teeth looks clean. I don't think I will go back."